Hello, and welcome to the Orthodontic Products Podcast. I'm your host, Alison Werner. In this episode, I'm joined by orthodontic consultants Andrea Cook and Jackie Dorst to talk about OSHA and infection control, but more specifically about how to avoid misinformation that could leave your practice vulnerable to compliance issues that impact patient safety, team trust, and the bottom line. We also talk about where you can find credible guidance and centralized updates. So let me give you some background on Andrea and Jackie. Andrea Cook is a clinical consultant who specializes in OSHA compliance, infection control protocols, and establishing sterilization room systems. With over 20 years of chairside experience, she also works with orthodontic teams to improve clinical efficiency, implement new technology, streamline training, and support overall workflow development. And back with us again is Jackie Dorst, a frequent contributor to Orthodontic Products. Jackie, a microbiologist and dental hygienist by training, has over 30 years of experience in the industry and is a nationally recognized speaker and consultant on infection prevention, sterilization, and OSHA safety as well. Her science-based approach has informed professionals at leading industry events worldwide, including the AAO. Not only will they talk about the risks of relying on outdated or informal advice and the resources that can help your practice stay compliant, they will also talk about why infection control and OSHA protocols are more than just checklists. They're part of what attracts quality team members in a tight labor market. They also weigh in on who should be responsible for overseeing these systems and how to ensure your entire team is on the same page. Andrea and Jackie mentioned a number of resources in this episode, so be sure to check out the show notes for links to those resources. And with that, here's our conversation. Jackie, Andrea, thank you so much for joining me today. I really appreciate it.
Oh, it's good to be here with us, Alison. Yeah.
Yes, and thank you for having us and letting us talk about the fun topic of OSHA and CDC.
Exactly. So as I said in my intro, we're going to talk about how your practice gets its information about CDC and OSHA compliance. Are you relying on that one team member, what they did at their old practice, or something you found on the internet? We're going to talk about why it's important to look to the experts to get information about infection control, sterilization, other issues to keep your patients and staff safe. So, Jackie and Andrea, what has your experience been with this, how people get their information? What have you heard on the ground or seen on the ground?
Andrea, you're in touch with the clinical team sometimes more than I am. I'm going to let you field that question.
Well, it started very heavily during COVID. There were so many formats out there, so many Facebook groups. There was a lot of groups. There was a lot of conversations going on. And that's when I got even more involved with the Facebook groups, trying to guide them a little bit. But everybody was looking for answers. It slowed down a little bit, but those groups are still out there. And sometimes they have good information, and sometimes they have information and it's not based on the current regulations, but based on what I used to do in my old office, what I did in residency, what Susie, we just hired her, and she was the OSHA coordinator at her previous office. So obviously she has all the answers. So we're going to change. And they're following that without relying truly on what the guidelines say and what we need to do. It's not fun. It's a lot of reading that is written in a format for our team members to really read and filter out the information. It's tough, but relying on people, your reps, sometimes I'll have a dental rep that's very educated, knows what they're doing. And sometimes I have a rep that really doesn't understand, but is going to offer solutions for you. We really just have to know what the guidelines are. Go to resources. Jackie and I know the guidelines inside out, upside down. That's a fun fact about us. But those reliable sources that don't have, Jackie and I work for our doctors. To get information, they come to us and we filter the information, whether it's which sterilizer, what protocol. We work for you to find the solution. We don't have a tool we're trying to sell that I want you to buy. So I'm going to say that's the best one. So that's what I'm seeing is there's just nobody really knows. And there's just a lot of information out there that's scary.
Jackie, what about you?
I agree with Andrea 100%. And we get these same emails and text messages that might be one sentence of, oh, Jackie, what do we do when this happens? Or I've just been nominated as the OSHA coordinator and I don't have a clue about where to start. And the assistants want to do their best.
Yeah.
They want to help their doctor, but they're juggling clinical, seeing the patients, keeping that schedule on time, and ordering supplies, and balancing the budget, and managing. So there's a lot of different hats that they're wearing. And sometimes we go to the easiest source, which might be a sales rep. And as Andrea said, some of them are very well educated. And Andrea, I find out some of them are very well educated on dental, but
Yes.
really not ortho specific as much.
Okay.
And
I see that a lot.
Ortho with their open bay design and patients. I mean, in ortho, we'll see 60 to 120 patients a day for one orthodontist. Now, if you've got a group practice, it could be even more. That's a heck of a lot more instruments, a lot more turnover of chairs, and you're working in that community open bay situation where parents are in the room and they can see what's going on and are observing everything. And actually, whether you're practicing to the standard of care with OSHA safety and infection control can impact patients' perception of the quality of your orthodontic care and your infection control.
Yeah.
I often have, not every patient's knowledgeable, but if they're in healthcare or have been involved in healthcare, they're going to observe, do you sanitize your hands every time you remove your gloves? Now, that can be a soap and water wash, or it can be an ABHR, but the OSHA law states sanitize every time you remove your exam gloves, and CDC guidance states the same thing. And say a mom or a dad that's a nurse at the local hospital is sitting there watching on that first visit at the ortho office. Now there's a question, and mom will bring it up and may even go to another ortho office. Andrea, have you experienced any of that?
Yeah, I just had a call a few weeks ago from an orthodontist called in a panic and said a dad was in with their child and was back in the Bay and observing this procedure and called her. I mean, luckily he did call her and give her a heads up, but he said, I noticed the instruments inside that sterilization pouch. The indicators on that pouch have not changed colors. So I'm questioning whether you're sterilizing your instruments. And her defense was, we use a dry heat sterilizer. We put them in the pouch after they come out of the sterilizer and then take them chairside. And I said, well, that's not following the guidelines. And she, just like we talked about, Jackie, the orthodontist I bought the practice from did it that way. So we kept doing it. And I said, well, it's not within the guidelines. Here's what the guidelines say. So unfortunately, the father is correct. And I would, call and, she wanted specifics out of the CDC guidelines to cite to him. And I said, I wouldn't go there. I would gently make it, yes, we realize, we apologize. We're, implementing systems to correct that. But she had just been doing it because that's what the older orthodontist that she bought the practice from did. And she said, well, I thought that was okay. So yes, I am seeing it. And I'm also seeing it from people who come in for interviews. They're noticing these things. And I've had a couple of reports to OSHA from an employee a potential employee that came in for an interview and then said, hey, this is not right. This is not safe work environment. So we need to be aware of those as well.
That's
it's
really
the patients and the parents, but it's also anybody that's in your practice, whether it's a applicant or a summer intern, whatever it is.
Yeah,
absolutely.
I would add to that you just brought up, Andrea, how important it is for having those excellent, competent orthodontic assistants. And we've all heard about the shortage during the pandemic, and it's continuing even now. And we're resorting to hiring employees who may not have had orthodontic experience, but they come in with the right attitude. They've got a great attitude. They have the potential for being a superstar orthodontic assistant, and we need to provide them with correct training. get them started in the right way. And that's a real challenge because orthodontics is unique. And we do, and I say unique, different between the general dentist and the oral surgeon and the periodontist, and to your doctor that said, well, we put the instruments in the pouch after they come out of the dry heat sterilizer.
Yeah.
She didn't know. She was continuing with it. And it makes me even question that office about how are they sterilizing their handpieces? Because you can't put handpieces in a dry heat sterilizer. And those handpieces...
There are going to be so many questions after we had this conversation and discussion that we had after. So there's a site visit planned to get back on track. One of the things I wanted to mention is, Jackie, you were talking about training. One of the things I see in summer is somebody will hire, Mary up front, her child's in college, so we're going to bring him in, and they're just going to do sterilization during the summer. It'll be easy. Yeah, just do that. So they bring him in. They don't train him. They don't give him anything, and that's the most at-risk person in your office. Somebody who is strictly doing sterilization with absolutely no training. You just opened yourself up for high risk. So that's one thing that scares me in the summer.
Yeah.
Jackie, do you agree?
I agree. And, that comes around to having those written training protocols and job descriptions and having that to go through with new employee orientation and onboarding, and huge risk for having a non-trained person in the sterilization area. Because Andrea, and you and I have said so many times, sterilization is not like horseshoes. You don't get close. It's either sterile or it's not sterile.
Or it's not.
Yeah. And there are too many potentials for breaches in the sterilization process to risk having a non-trained person. Yeah. So that said, if I'm an orthodontist and maybe I'm a doctor who's been practicing for 20 or 25 years, and I'm looking to make certain that all my systems are up to date, where do they go for information? Or if I'm a young orthodontist coming into practice, where do I go for information? Or even the orthodontic assistant. And finding that reliable information is a real challenge with it. And I'd like to offer a couple of resources, because Andrea and I love going into offices and we love doing the webinars and Zoom meetings, but even as busy as we are, we can't get with every orthodontic office. And there are a couple of resources. The American Association of Orthodontists has the AAO Staff Club. And it's an online CE, continuing education, but a training program, and the whole team can join for $75 a year.
Oh, okay.
And they have an online OSHA program that is updated every year. It's within a 1-hour time frame. You can take the course and then you get your CE certificate, and it's the basics. It requires the OSHA coordinator or the OSHA leader in the office to go back and customize for that particular office's situation, such as how do they sterilize? Where are the fire extinguishers located?
Yeah.
Where's the eye wash station? And how do you operate it? All of those things. Okay. But I'm going to give the AAO's education director her email address, if that's okay with everybody, because she's new. She has just joined. Her name is Tori Cannon, and her email address is vcannon, CANNON, at aaortho.org. So that's a non-biased, non-commercial, no products being sold. It's not like getting an OSHA training from your local dental supply rep that, hey, their goal is to sell product, at the end of it. And like I said, every year it's current, it's updated, and it's a great starting point for that accurate information. And Andrea, to the sterilization point, on that AAO site, there is a basic infection control training that I did about 3 years ago, but it's still current with it. And then the second thing that I'm excited to introduce is brand new. It comes from the Association for Dental Safety's conference that was held at the end of May, so it's really recent. And ADS has now introduced Ask ADS, that is an artificial intelligence to answer all of these complex questions and provide the resources and the references with it.
Okay.
So again, for your listeners, I'm going to give them the website for it. It's www.myads.org/ask, A-S-K dash ADS. And it's available, it's open right now. It's available to everybody. It is free. It won't be free forever. Right now, it's gone through the beta testing. It's just been launched. And ADS is encouraging all dental and orthodontic professionals to check in on it and give it a try, because it looks like a droid. You remember R2-D2? Yeah. Well, that's the symbol for it. And her name is Betty. And you get to ask Betty a question. And Betty does not like ChatGPT. She doesn't pull from public resources, but she pulls her information from dental and medical resources and from state dental boards and from OSHA, and she cites those references with it.
Yeah.
So it's really, it's specific for us. But Alison, as you know, using any AI, the answer is only as good as the question, right?
Right, exactly. So you do have to ask follow-up questions and train it and get it to where it needs to go. But I wanted to ask you guys, given everything that's happening with Department of Health and Human Services and CDC and OSHA, where should orthodontic practices be looking for information if there is some dispute as to what is out there? Is it going to AAO? Is it going to going to ADS? Is that kind of the alternative to still feel like, okay, you have the best information that's available and you're maintaining those standards to keep your practices safe and your staff and patients safe?
Well, I'm going to jump in on that because I did just recently attend the ADS conference, and this was a hot topic. It was top priority with the lack of funding, the closure of the Oral Health Division at CDC.
Right.
I will say to everyone, just because the Oral Health Division at CDC is discontinued, the guidelines and the recommendations are still the same, and they're part of the State Dental Practice Act.
Ah, okay.
So most state dental boards will refer to the current CDC guidelines. Going forward to the future, there will be a needed resource for this non-commercial information, and the Association for Dental Safety will step into that.
Okay.
Now, I'm preempting a public announcement on this a little bit, but there is endorsement from all of the dental professionals.
Okay.
The AAO, the ADA, the AAP, all of the oral surgery group, the endo group, they all, because the Association for Dental Safety has been such a leader in infection control for over 40 years.
Okay.
And even when the dental unit waterline contamination was infecting patients, the Association for Dental Safety had been researching that and looking at it for over 35 years and had published the white paper on how do you manage dental unit waterline contamination. And that in turn was adopted by CDC. So it became part of the Centers for Disease Control with their guidelines and recommendations. Going forward, ADS will have an institute for dental safety and dental infection control. So this is, and it will write the standards and the guidelines that in turn will be referenced and adopted by both OSHA and the state dental boards.
Okay.
And I'll further go in, and Andrea may add some more information. We do get a lot of conflicting confusion, I should say, from orthodontists and from clinical team members about what is an OSHA law and what's a infection control guideline from the state dental board and from what was CDC going forward. It'll be our standards. And I bet you run into that all the time, Andrea.
I do. There's a huge confusion between what OSHA is and what CDC and your state dental board is. And I'm going to go back to our original when we first started talking was when you get these questions about what do I do? Go to reliable sources. Go to your state dental board, CDC, OSHA. I know it's hard to gather the information, or go to an independent resource that understands the guidelines, knows them, and that can guide you towards compliance versus this is what we did in our old office. I have this new product that's going to take care of that for you. Those are opinions.
Yeah.
And I encourage fact finding.
Well, and I know just in talking to you guys, you said like a practice might come to you with a one sentence question, but that response from you, your research, that could take you hours to answer that question and to compile all that information, which is maybe not a one sentence response. It could be an entire document or a group of documents. So it takes time to answer those questions. It can't just be a quick, you can't just, expect it to turn around. Yeah, exactly.
And we have to be very cautious about what we do reply in emails or text messages because it gets shared, and we're dealing with laws,
right?
With both OSHA laws and dental board laws, and that could wind up having further influence, let's say, with it. So it is, having these resources that are reliable is so important for the team members, and not going to, well, in my Facebook group, they said, or in this purchasing group, they said, because I see a lot of information posted that is not correct.
Right.
Yeah.
Right. Absolutely.
It's funny. Sometimes in some of the groups, somebody will post a question about what do you do about this? And I find it interesting and scary to hear the responses, because I hear, a wide gamut, and 90% of them may not be within compliance, but it's based on what we do in our office or things like that. And so that's how they're gathering their information. And I think it's just scary. I don't want to see people going down a path that's not in compliance and can put themselves, their practice, or their patients at a higher risk than they already are at.
Yeah.
So
is there a theme or a common question that you see from staff or practices that pops up a lot in those kind of groups that just keeps being brought up over and over again? Or what are the top 3 questions you get regarding like OSHA?
My first one is, do we really need to follow the OSHA and the CDC guidelines? And
yes, okay.
That's the first one.
Okay.
This is kind of vague, and yes, you really do need to follow them for your own safety,
right?
For the safety of your practice and your patients. There's a lot of questions on training and documentation now that people are not understanding what they need to do. I think there's more focus from CDC, State Dental Board, and OSHA on having documents, protocols, logs, things like that in place. And it's just not happening in our offices. A lot of it is based on, I don't know what to do. I don't have time to do it in the first place, and I don't have time to investigate. So I'll figure it out later, and it just doesn't get done.
Yeah.
Andrea's so right. And I love the quote, if it's not documented, it did not happen.
Yeah.
If you can't, if that OSHA inspector showed up, or the state dental board, or the health department, and they're asking for a document on, have all of your clinical employees been vaccinated for hepatitis B, and you can't produce the paperwork, then it didn't happen. And you have a citation. Same thing with, say, your sterilizer. Do you have spore test records that you could produce? And Andrea, one of the things that I've been running in the last couple of years, I like to do a virtual walkthrough with an office before I do an online training. Best is when I can go into the office and actually see their physical facility and what they're doing. But we can't be everywhere. It's not geographically possible. So I come up and I have the assistant call me on a FaceTime call. And we go through a checklist, and they're walking through the office and showing me where their OSHA poster is and showing me their sterilization room. And the most frequent thing that I run into is I go, okay, are you treating your dental unit water lines? And they go, yeah, we have a tablet, or yeah, we're using the straws in them. And then the next question, if you just go with that yes or no question, you don't get the background on it. And I go into, okay, which product are you using? And when do you shock? Shock? Are you supposed to shock?
That's that shocked look on their face.
Yeah.
Yeah.
Oh, dear. And then the next question is, how are you testing your water lines? And that's the same test. How do we test? And that waterline test is documentation, just like the spore test is on the sterilizer. And now state dental boards are requiring it. We're seeing both Georgia and Washington State have passed laws that require and specify how often the testing has to be done and how long those testing records have to be maintained. And that's a critical step that I've seen that many orthodontic offices have not implemented with their orthodontic unit waterline management.
I have the same look on their face when I ask them if they're testing. It's like, I don't know.
Well, then it sounds like a lot of the issue is record keeping.
That's a huge piece of it that is not happening in offices based on time, or I don't know what to do. And it's a huge piece of what they are looking for when you get a visit from any of the regulatory bodies. That's what they want, is documentation. They don't care if you say, I've done a spore test every week, I've tested my water lines. Like Jackie said, if it's not documented, it's not done, and you're going to be held accountable for that.
Yeah.
So learning what you need to do is part of it, then getting the protocols and documents set up to make sure we have our logs, and make sure that we maintain that consistency between team member turnover that we're experiencing a high level.
Right.
Things just fall off.
Yeah,
just,
absolutely.
Well, Mary used to do that, and I don't know. It just stops happening.
Yeah.
Or
So
Mary
those are
had
key
a baby.
pieces right now.
Mary had a baby, went out on maternity leave, decided not to come back, and then nobody else picked it up, and it fell through the cracks. Yeah.
Or we don't remember where the file is on the computer.
Yes.
Because I know I've heard Jackie talk about that one.
Yes.
With those AAO resources and the ADS resources, do those resources talk people through the record keeping that they need to do and what they should have on file?
The Ask ADS is not. It's only a AI answer questions type device.
Okay.
Now, I know that as a consultant, I have a one-page checklist that I go through, and that sort of summarizes. I know when we've done the in the sterilization room with Jackie episodes during the pandemic, we provided that. I'm sure Andrea does too. Andrea, do you have that available on your website?
Yes, I have 2 checklists on my website. So it's AndreaCookConsulting.com.
Okay.
There's a tab that says downloads, and there's an OSHA compliance checklist and a CDC compliance checklist. This does not take into account any state specific. This is a general CDC guideline, but it's a good place to start. Anytime you check, yes, we have that and it's up to date, you're okay. Any of the boxes that you check, no, that's an area for improvement or change for your office. And that's when you're going to have to begin the investigation of, okay, we're not doing that. So we're not testing our dental water lines, water lines. What do I need to do and how do I need to document is the next step, but at least identifies it and gives you a place to start.
Yeah.
So.
Yeah.
And I'm going to add 2 Andreas with it, because that's a great resource that's orthodontic specific. And Andrea is much better at digital management and virtual connection than I am. I'm still a little bit behind the curve on that technology with it. However, I would encourage that every orthodontic office should have their infection control leader and or their OSHA leader. And those are 2 different things. Remember, although OSHA and infection control overlap, but they should be a member of the Association of Dental Safety. It's not an expensive membership, and they will get the latest, most current information, a monthly video training with it, a bi-monthly infection control in practice, continuing education newsletter that focuses on it. Membership is only $125 for a whole year. I've been a member since I began speaking and consulting. And I know it was one of the first things when I met Andrea, and she said, this is an area that I see as a real weak point for orthodontic offices. They need clinical help. And I said, join the Association for Dental Safety. That's the best accurate information resource. So I would highly recommend spending that $125 and having at least one team member join.
The other thing I'm going to add, we touched on this earlier, though, was please give your infection prevention and your OSHA coordinators time to do these things. This does not happen in between patients when I'm trying to seat one and it's 4 o'clock and then I have to go do this and I have to get the scan in. That's not how this happens. It happens when I can sit down and I can think it through. I can investigate. If you use my checklist and there was an area for no, I have to have time to look at the resources that are going to guide me. So this doesn't happen between patients. I need some time set aside where I can just have it be quiet and I can focus and get this done. Otherwise, it's not going to happen.
Well, and then what is the cost of not having it in place? What are some of the penalties we're talking about here? There is reputational, a penalty, like you said, with that father who spotted the indicator wasn't there on the sterilization. What is he going to tell other parents?
Could he possibly post something?
Right, exactly.
Possibly.
But then there's also fines and complaints against as well.
And not getting the quality employees. The employees who are knowledgeable and want to work in a state-of-the-art orthodontic practice look for an employer who is concerned about their safety and well-being, who has all of those systems in place, not that it's helter-skelter. And then you've already got the systems, and as you hire new employees, you have the right way to onboard them and train them and insert them into your orthodontic clinical team.
Absolutely. Absolutely.
But I don't know. The OSHA fines right now, Jackie, what are they? They're over 2,000 per infraction?
Yeah, and 16,000 per infraction could potentially be. And if it's a willful or a where you've been cited and you didn't make the correction, it can be up to $165,000 per day.
Oh,
yeah. And the OSHA fines. Also, go ahead.
The $160,000 hurts community reputation. You can't get that back.
Absolutely.
Once that's tainted, I just advise you not to go there.
Yeah, absolutely.
Yeah. And OSHA inspectors, when they come to the office, it's important for the team and the doctor to remember they're not there for a confrontation. And they are industrial hygienists. They are not clinicians. They're not sterilization experts. I know when the OSHA bloodborne pathogen standard was first passed, I was asked by several state OSHA departments to train their inspectors on what to look for in a dental office because they didn't know what an autoclave was. They were not familiar with it. They're familiar with our electrical outlets overloaded. Can you get out the exits and that other emergency preparedness with it? But when they come in, they do have their checklist to go through. And you need to have a system for, if you do have an inspector come in, and it may not be OSHA. It may be the state health department or the state dental board with it, because I've seen more inspections from state health departments of dental and orthodontic offices since the pandemic than I've ever seen previously. Yeah.
Okay. And you have to remember, OSHA inspectors are real people. So I got a call from a doctor that said he was doing an initial patient exam for a child. So he was asking the dad that was there, so what do you do? You're off during the day. What do you do? And he said, well, today's my day off. I'm an OSHA inspector. And the doctor said his face just drained. He said, all I could think about was, are they wearing gloves? Where's the OSHA manuals? What do I do? Did they have this in place? He said, I have no idea what the kid's teeth looked like because That's all I could think of. He said, I walked out of the office from that new patient exam and said, you guys handle the clinic. I'm calling Andrea. So, and they're real people, and he wasn't there doing an inspection.
Right.
But you never know.
Yeah.
So,
Well, that's the thing. Any inspector from any organization is going to either be a patient or have a child who might eventually be a patient. So, you know, because Jackie, I remember when we were doing the COVID series, you talked frequently about, you know, like, are you wearing the right mask? Are you doing the hand hygiene? And you talked about a parent who was a nurse who came in and, you know, who were they going to tell that the practice wasn't properly following PPE guidelines, you know, when they go back to work?
I have a letter from that involved an orthodontic practice, let's just say in the Northeast.
Mm-hmm.
And the mom that came in with the child for her son's first bonding appointment with it observed several discrepancies, and she wrote a detailed letter to the doctor about not sanitizing hands in between, that the doctor came over to examine the child with one gloved hand and not a glove. So I can just imagine the mirror, Andrea, can't you? They're
yes.
just looking, do we have the right arch wire? Does everything look? But the other hand was ungloved. So she listed about 5 items that she observed during that appointment. And what her statement was, early in my son's treatment, we now have a level of distrust throughout my son's treatment. And as the infection prevention manager at the local hospital, I find these violations in contradiction to the State Dental Practice Act and reportable to the state board. So she put that in writing. Not all patients will take the time to do that, but that's a huge risk for the practice. She's now a force multiplier. She's going to talk to every nurse she knows, all of the doctors, everybody at the hospital about what they do at the hospital is great, but oh my gosh, can you believe they did this at the orthodontic office? Mm-hmm. That's, community perception. And we work hard to treat patients. And doctors and clinical team, they care from their heart, and we change patients' lives with the beautiful smiles that we create. And when you get a comment like that, you feel like you've been kicked in the gut. Yeah. We're managing this schedule. We try to do everything right, but they didn't know.
And that's a lot of it. Most of the time I find infractions are, especially from my team members, it's not an intentional, I'm going to do this wrong, or I'm not going to do that.
Right.
It's, I didn't know. My doctor didn't train me. Mm-hmm. The office I was at before did it this way, whatever it is. But the training, the fault falls on the office as far as not setting those expectations and then upholding team members to say, no, you have to do this.
Yeah.
And following through with that. So a lot of it is, like I said, I've maybe had one intentional team member that was not following the rules, but most of the time it's just lack of education and training, and it comes back on the office. We got to do it.
Who should be the leader in this implementation, in this keeping track of what's going on in the office, of making sure that we are in compliance? Who should be the leader? A staff member who's handling all this stuff, or should it be the orthodontist?
The doctor has to set the tone.
Okay.
The doctor is the manager. The doctor sets the tone for the entire practice, that this is a practice of excellence and that we are going to provide the quality care to the standard with it. And with that, then the doctor can delegate to the OSHA leader, to the clinical team manager. To me, the clinical team manager is the ideal one to be the OSHA manager with it, because they know which supplies we're using, what the procedures are. It can't be an administrative person who is distanced from the clinical area. Okay. But without empowering that OSHA coordinator, they have no recourse to go to, such as you have a team member who will not wear her safety glasses. She doesn't like them. She finds them uncomfortable. Right. And the doctor is ultimately responsible from OSHA's point of view that if that assistant who does not wear her safety glasses has an eye injury, she clips an arch wire and it goes flying into her eye. She's spraying and rinsing off acid etch. It goes flying into her eye. If she has eye injury or even worse, blindness from that accident, then the doctor and the office is going to be responsible for that to OSHA and for the rest of that employee's life under their liability with it. So ultimately, the doctor is responsible, and the OSHA law states that employers are required to be certain that to provide the PPE for their for their employees, but to see that it is used.
And I agree that the doctor is ultimately responsible. When I work with an office and we're trying to develop the infection prevention coordinator, the OSHA coordinator, I look at tasks that are on team members. Sometimes I have my clinical lead that is underwater. And I know if I put that task to them, it's not going to get done. But I may have somebody that has a little bit more energy to bring to the table. They have to have an interest in OSHA, CDC, and in following the rules. If they have that interest. So sometimes it's not the lead or somebody who's tired. It's somebody who has an interest in it. And they say, I can take that on. And that's a great person. If you give it to somebody or ask somebody and they're like, I have to.
Right. Yeah.
Okay. And Andrea and I are always looking for that spark, that clinical team member who goes, yes, I am passionate. Oh, and then when we come in, they go, oh, it's so good to hear somebody else who feels the same way about this.
That's your person.
That's the spark we want. Yes. The one who's passionate about it, they will do a great job with managing it and inspire the rest of the team. And as I've learned from Andrea and all of the other great orthodontic consultants and speakers over the years, it's so much more effective to inspire from the positive rather than to beat somebody over the head with the negative. And all of the emphasis that we can put on that is greatly needed because it is a huge task. And as Andrea says, the clinical leader can be underwater. The office manager can be underwater with it. And the doctor doesn't know. The doctor is busy doing doctor things, which we need them to do. And they need someone that they can rely on.
Absolutely. Well, thank you so much for joining me for this conversation. It has been a joy. And I always love talking to you, Jackie. And Andrea, it's great to finally have you on. What's the best place for people to get in touch with you, Andrea, if they would like to work with you or get some help?
I'd say go directly to my website, AndreaCookConsulting.com. You can contact me through email, phone, all of my information is up there. The downloads start there and check and see what your level of compliance is. And any of the no's, I would love to work with you and help you get more compliant, a safer place for you and your team members to feel good. And your patients.
Exactly. And Jackie, you?
Well, Andrea, Alison and Andrea, I have that website, although it does need to be updated. So I'm just going to give you my email address with it. It's safepract@gmail.com, SAFEPRACT@gmail.com. And if you forget it, it's on every one of those AAO presentations and webinars that are on the Staff Club site. So if not, Google me or get in touch with me. And sometimes it's a text message with a photo that helps. So I'm even going to give you my cell phone number, 949-842-1747. And have a safe, sparkling summer in your orthodontic practice.
Absolutely. And we will have a link to all those resources that have been mentioned, include their contact information in the show notes. So again, thank you, Andrea and Jackie, and we'll see you for the next episode. Bye. As always, thank you for joining us. Be sure to subscribe to the Orthodontic Products Podcast to keep up with the latest episodes, and be sure to check out orthodonticproductsonline.com to keep up with the latest industry news. Until next time, take care.